Good evening, my name is Courtney Matheny, and today in my audience I have Mr. Stanley Perkins on my left and Mrs. Wanda Phillips on my right. At some point this year, you've probably seen a nurse practitioner, and maybe you don't even know it. I'm sure you've been to the doctor or to the hospital at least once, either this year or in your lifetime. The information I'll be providing for you tonight has either been verified by the American Nursing Association or the American Association of Nurse Practitioners. A registered nurse is someone who facilitates healing, and a nurse practitioner are nurses who treat patients without the direct supervision of a physician. So let's first discuss what a registered nurse is. As I stated, they're people who facilitate healing. One of the biggest ways in which they do this is by administering medications, and this is under the direct supervision of a physician. By doing so, they're able to alleviate pain for some of the patients. Another major way in which they alleviate pain for patients is by repositioning patients in a hospital setting. This allows them to provide optimal comfort and to also prevent decubital ulcers. A major way in which they facilitate healing is by checking the vital signs every so many hours, and this allows them to ensure that your body is staying within homeostasis, which is really important to you as a patient. A nurse must also obtain an associate's degree or a bachelor's degree, and this signifies that they're a registered nurse. Now that we have an understanding of a registered nurse, let's kind of discuss what a nurse practitioner is. A nurse practitioner is a nurse who treats patients without the direct supervision of a physician. The best way I can explain this is by giving you an example. Most nurse practitioners today are found in clinical settings. So let's say a patient comes into a clinic and the nurse practitioner would assess the patient, they would then diagnose the patient and treat the patient. The key word here is to treat. And by treat, I mean that they would prescribe medications to the patient without the direct supervision of a physician. In order to be a nurse practitioner, you must obtain at least a master's degree in nursing. So we can see how both of these nurses and nurse practitioners really play important roles in our health community, and they differ, but they are both important. And so a nurse is someone who facilitates healing, and a nurse practitioner is someone who treats patients without the direct supervision of a physician. Thank you.